The COVID-19 pandemic has also highlighted the distrust in the medical profession for many Black Americans. Fox 43's Rachel Yankunis spoke with Dr. Eugene Curley from WellSpan Health about his work to fight the spread of disinformation and vaccine hesitancy.
Hi, Dr. Curley.
Hey, good morning.
A conversation with Dr. Eugene Curley, medical director of WellSpan's infection control and prevention team. He knows the unprecedented challenges Black families have faced over the past 2 years.
To put things into perspective for people, what challenges has the pandemic created for them?
When it comes to healthcare issues that affect the minority communities, Black and brown persons, we talk about the so-called social determinants of health. And what we really are trying to combat here, using COVID as an example, is combating any of the health inequities that contribute to Black and brown persons having, let's say, worse outcomes from COVID-19.
The vaccination rates among people within the Black community are still relatively lower than that of people in other racial groups. Does that suggest that there's still quite a bit of vaccine hesitancy?
There is. There are a variety of issues. Social media. Unfortunately, this issue, among other COVID-19 issues like masking, has become politicized.
And how important is representation? That a patient can relate to their doctor or their nurse, whether that be more Black doctors entering the field. Is that something that also has been an ongoing discussion, that there isn't enough representation?
I think that has been an issue over time. It continues to be an issue. I actually am very proud of the diversity at WellSpan Health. It's one of the reasons why I chose to come there. But you bring up a good point. It's easier to develop that trust if you're able to relate to your patients and are able to communicate with them in an effective manner, where you're not, let's say, talking down to them, but you're making them a part of the conversation and making them involved in their care.
Prominent voices in the Black community have been fighting the spread of misinformation, holding virtual town halls and working to build trust in their communities.
And there are a lot of prominent voices within the Black community, like yourself, who have really been the unsung heroes in the fight against COVID by fighting the spread of misinformation, working on improving accessibility. Can you talk about some of the efforts of Black community organizations, how those outreach efforts really help to change the trajectory of infections and deaths among people in the Black community?
WellSpan Health has reached out to faith organizations, churches, really partnered with community leaders to make sure we're addressing any concerns in the community. Some of the big concerns that I've addressed at some of these groups and town halls was the safety of these vaccines. And again, we have overwhelming data showing that it is very safe, and hundreds of millions of Americans have been vaccinated and are doing well at this point.
So what is your outlook on what's to come as we enter the third year of the pandemic?
I'm keeping my fingers crossed. With us having more treatment options, I'm hoping that, one, we don't see more variants down the road, although that's still a possibility. As far as the future of the pandemic, I think a lot of that relies on us.
Dr. Curley, thank you so much for your insight and for taking the time to talk with us. I really appreciate it. Is there anything else that I didn't ask that you think is important to add?
No, I think we hit everything.
All right, I think we did, and then some.